Hi there, I'm Dr. Rachel Taylor, and we are going to talk about the microbiome today. What is the microbiome? I'm about to tell you probably more information than you even ever wanted. Let's start by talking about why I'm so obsessed with the microbiome. First of all, because I'm a doctor and I do functional medicine, but this started way back in college when I got my bachelor's degree in microbiology with a minor in chemistry and ultra nerdy. I got honors in microbiology by doing extra work. So that is why I'm so obsessed with the microbiome. The other reason I'm obsessed with the microbiome is for several reasons. It runs almost everything in our body. I know that we've all heard of, oh, take a probiotic if you take an antibiotic and things like that. And to touch on that, actually, it is very important to take a probiotic when you take an antibiotic. And one thing that they don't tell you, or that's less common knowledge, I guess, it's not a secret, is that if you take a probiotic on the same days as the antibiotic, not at the same time. So I tell my patients, for example, if you're on an antibiotic and you take it morning and night, take a probiotic in the middle of the day, because it is found to reduce nausea and diarrhea and different things that can happen while on the antibiotic. And just so you know, nausea, diarrhea, all of those things are very common with antibiotics. It does not mean you have a reaction. I mean, it was really bad. You definitely, you might want to steer clear of that one, but typically speaking, diarrhea, nausea, things like that can come with an antibiotic. So, that's another thing that you definitely want to focus on probiotic in the middle of the day. And what kind of probiotic should I get? It's difficult. I'm not paid to endorse any sort of brand, but I will tell you a lot of times what's commercially available for patients that I have liked is Garden of Life. They have a really good brand. Again, they don't pay me. You really want to find also a spore-based probiotic. That one's really good. It survives better in your stomach because it can get through all that gastric acid area. What else? So more about probiotics. So it controls almost everything, as we talked about. One of the biggest things that I see, especially with some of my patients that are on a bunch of psych medications, is that they have not addressed their gut at all. And it's very common for gut health to affect our mood. So what is gut health? Gut health is, again, having those very specific microbiome, those very specific bacteria in your microbiome or in your gut. So let's talk about it. When you have a healthy microbiome in your gut, there are various different types of bacteria. It's not like just this one or that one. You want to have heavier on some of the other bacteria that are healthier and not growth of, different types that are trying to, ruin things inside there and make things worse. So what can happen is, if we don't address the unhealthy gut bacteria, is that they start producing these toxins. The ones that are not healthy will produce these toxins. And over time, these toxins can start leaking out into your body and causing immune issues. So all of that inflammation can go everywhere in the body. The brain, it's associated even with epilepsy, seizures, bipolar disorder, autism, all sorts of autoimmune conditions, thyroid, Hashimoto's. Gosh, I can go on forever. These are all shown by science, by articles, to be affected by what we call dysbiosis. Okay, what is dysbiosis? Dysbiosis is when your gut has bacteria other than what we would expect for a healthy gut. Usually this is in the place of bacteria that are commonly in the gut, but these are things commonly in the gut. However, if they're wrong, actually, let's start that over. Okay, so what is dysbiosis? What is it called? Let's start over. What is dysbiosis? Dysbiosis is a fancy way to say the amount of bacteria in the amount that we would expect them in for a healthy gut are not present. So say, we want a lot of bacteria 2 and 3 and not a lot of bacteria 1 and 4. So you take, but if you have a lot of bacteria 1 and 4, they overgrow the 2 and 3, then we have a dysbiosis. This is a fancy medical word for not not right, dysbiosis, and biosis is another word for bacteria. So think about antibiotics, dysbiosis, so that's talking microbiome, so that's all of us, we're talking about the healthy bacteria. So what happens when we have dysbiosis, or a lack or a problem in our healthy bacteria in our gut? We already discussed so many things and what kind of probiotics to buy and what it can be associated with, but now we're going to get very specific. So dysbiosis, or unhealthy gut bacteria, is associated with mood problems. Most of the bacteria in your gut is what makes serotonin, and 80 to 90% of serotonin is made in your gut. And the people that help, or the little guys that help, are those healthy bacteria in your gut. So I have had a few patients, for example, on 3 or 4 depression medications, really kind of struggling still for their mental health, and finding difficulty with motivation with exercise and all of that. So we started her on a probiotic for mood, and that one change got her off of 2 of her medications. So it's very powerful changes that you can make. Another thing that you might not know is that when the bacteria overgrow in your gut, called SIBO, or syndrome of inappropriate bacterial overgrowth, that can actually cause a lot of big issues: bloating, you can't eat very much, you feel terrible, constipation, things like that. And that is another indicator that we are having some issues, and maybe full body autoimmune issues. So we do something called the lactulose breath test, and you can tell what kind of bacteria are overgrowing based on that. Then we treat with a course of antibiotics. You have your choice of like medical antibiotics, or typical Western medicine antibiotics, or herbal antibiotics, things like berberine and allicin. These different things can help treat SIBO. After you treat the SIBO, this is caught on in Western medicine, the SIBO and that kind of treatment now. But after you treat SIBO, there's a whole gut rebuilding. It's not just here's a probiotic. We need prebiotics. We need gut health, different supplements. We need a healthy probiotic. We need counseling on how to eat for your healthy microbiome. You need movement. Even exercise helps with the healthy microbiome. So if you're being treated for SIBO, please make sure you follow up with a good gut rebuilding exercise, gut rebuilding protocol. And this includes nutrition and movement. Any sort of movement you can do. If you don't need to go run a marathon. Actually, running marathons can cause muscle breakdown. So just remember, it's okay to be moderate about exercise, and that will be the best for your body. Okay, let's talk about our mouths. I know, crazy, that healthy bacteria in our mouths. Actually, our mouth and teeth are part of our immune system. So what happens? Sometimes we, have our new boyfriend or girlfriend. Sometimes we're not eating healthy. Sometimes different things like that. We've kissed someone, and our healthy bacteria in our mouth can be changed. Okay, so what happens? That unhealthy bacteria in our mouth can cause problems like cavities. As of now, I believe there are some probiotic toothpastes. I can't tell you a brand. I have not tried them yet, but that's one thing to keep in mind. And if you're taking a broad spectrum probiotic, hopefully it covers the mouth bacteria as well. See if maybe your dentist has a suggestion, but keep in mind, this is a big deal to have a healthy mouth microbiome. Okay. Now let's talk about the microbiome and weight. So the microbiome and weight. People don't know this, but the microbiome and weight. People don't know this, but the healthy bacteria in your gut are highly linked to your weight. There are some studies where they take, I know it's gonna sound gross, it's in mice, where they fatten up one group of them, and then they don't do the other group. And as the bigger mice are developing issues, high cholesterol, diabetes, they take a fecal sample, I know, gross, from one mouse and put it into the other mouse, and actually just changing their microbiome help them decrease weight. So, you know, a lot of people out there trying to lose weight, oh, what's wrong with me, that kind of thing, don't know that one really easy way to help with weight loss is by using a probiotic that is specifically meant to reconstruct your microbiome in a way that would be more of a mimicker of somebody who has a normal weight, like constitution, what they would have. That's really important and kind of a really cool, easy way to do to help with weight loss. And, you know, just really taking the power away of like, it's me, something's wrong with me. Like, really keep in mind that there are so many little factors. Sleep is also huge, you know, for weight loss and things like that. Okay, another thing that's important about the microbiome is skin. There's healthy bacteria and unhealthy bacteria on the skin, and sometimes they are the same thing. So we call this an opportunistic infection, and this can happen anywhere on your body. Keep in mind, the bacteria, the healthy bacteria on your skin are not the same as what's in your mouth, what's in your gut, what's in, you know, your lungs or whatever. Anyway, okay. So we were gonna talk about, let's start that one over. Okay. Have healthy bacteria, the microbiome in your skin. This is very important. So what can happen with the microbiome on your skin is that some of the bacteria that are actually normal to be there can then overgrow and cause an infection. And that's why it's really important that we know like the symbiotic relationship of the bacteria. So if you have healthy bacteria on your skin and everything's fine, if you get a cut, then it will help your wound heal and it's healthy and it's, you know, they're working together. However, a lot of times we can have issues with antibiotic resistance. So that would be someone who's been on a lot of antibiotics or to the hospital many times and may have a resistant bacteria. And even without a resistant bacteria, what can happen is that you can get a cut in your hand or wherever, or even a little bug bite that we squeeze too much and it creates an issue like an opening. And these formerly healthy bacteria can climb in there and cause some infection issues for us. So, you know, there are multiple ways to do the skin microbiome. Again, there's typically probiotics. I know there's probiotics specific for the skin. And this may be helpful, you know, and don't feel free to be weird about it. You can probably find creams and things like that. Find a capsule for the skin. You can open it and pour it into something, put it on your body, you know, or just take it by mouth. You can totally choose, up to you. So, but keep that in mind if you're having recurrent skin infections or, you know, even really bad acne. These are some things you may want to keep in mind. Now, when we treat acne to address the unhealthy microbiome, what we do is we put something like salicylic acid or benzoyl peroxide, clindamycin, doxycycline, all of these essentially antibiotics, whether on our face or in our mouth. And that's just a good demonstration of how we're trying to kill these unhealthy bacteria. So, you know, I'm fine with people using the topicals by mouth. If that's what you need for acne, go ahead. I definitely struggled with acne in high school. You know, it's okay to take a medication if you need it for acne, of course. One thing you can do to augment the medication to help it work longer and maybe eventually clear it up and not need another medication is that you can use the skin probiotic. So skin probiotic, of course, lifestyle changes. You need to drink more water, less greasy foods, exercise. I mean, everything 1,000% usually goes back to nutrition. But using a skin probiotic may be helpful in healing and continuing to heal the skin, and therefore in the future not either having as many infections or as many pimples or acne, and maybe clearing them up forever. I do believe it's a really good idea for you to at least give it a try. Keep in mind it might take 3 to 6-ish months to see long-term effects because it takes a little while for the healthy bacteria to say, here I am, I'm back, I'm gonna take care of this. So that's a suggestion for skin microbiome. Okay, let's talk about UTIs. Women and some men who get recurrent UTIs let's talk about recurrent UTI for women and first-time UTI. So it's very common, and men occasionally, typically men have other complications. So I'm going to address women specifically. So we see a lot of UTIs, of course, and I'm sure that women know already the little tips. Make sure you wipe front to back, make sure you pee after sex. If you're constipated, you may be more likely to get UTIs if you're not drinking enough water. So these are all the basics. If people don't know, now you know. If you have any further questions, feel free to DM me for any other suggestions. However, one of my biggest suggestions is, or one thing I'm seeing is a lot of patients for UTIs are being put on a chronic antibiotic, or, they're put on, okay, take this antibiotic pill every time after sex. And I'm finding it very difficult and frustrating that these patients are not put on a urinary tract probiotic after we're barraging their urinary tract with antibiotics over and over. And we're not addressing, well, what about the healthy probiotic? So in UTIs, as with any other part of the system, we are seeing that we are stripping the area of the healthy bacteria when we give the antibiotic. And the thing that makes that the problem is that the healthy bacteria, our first little armies, these are something that can fight for just the healthy bacteria until even our white blood cells are like, hold on, we're helping. They can avoid any of the immune response if the healthy bacteria are intact and keep it away, keep everything in synergy. So that can be a big problem if we're killing the healthy bacteria over and over and we're never addressing, hey, we might need to put the healthy bacteria back on our urinary tract, because that is our first line of defense against UTIs. I'm going to suggest anybody who has recurrent UTIs, if you take, especially if you're taking the one antibiotic after having sex, you may want to think about or strongly consider getting on a urinary tract specific probiotic. I certainly have suggestions if you want to DM me. I don't know. I don't know if I'm supposed to give suggestions for certain brands on, any sort of platform unless, I have association with him. So if you want help, let me know. I can certainly give you specific brand suggestions. However, if you're a woman and you are having recurrent UTIs and you're taking one antibiotic pill after sex, or you're on it all the time, or you have more than 6 UTIs in a year, you can or should start taking a urinary tract specific probiotic, because that will give you the healthy bacteria back. Will also help you with, excuse me, it will also help you with stopping urinary tract infections at all with your little fighter army down there at your urinary tract. So if you need any more suggestions, let me know about that. I'm happy to help. Okay, now we're going to address women's vaginas. So welcome to the microbiome vagina discussion. If this bothers you, too bad, it's part of science. Get over it, or get off this video. I do not need your feedback in my in my comments about whether or not I should be talking about vaginas. So, women's vaginas. Women's vaginas have a very healthy and very kind of picky, I guess is the word I'd say, or fragile balance. So, if you're a woman and you are at least in your 20s, I would guess, you wouldn't be surprised if you've heard of BV, bacterial vaginosis, and yeast infections. Neither of these are STDs. Bacterial vaginosis is not an STD, neither is yeast infection, just to be very clear. When we get bacterial vaginosis, actually, let me start again. Okay. So the ecosystem in the woman's vagina is very, very, very sensitive. There is yeast on one side and bacteria on the other. And these can be very healthy, living together in harmony, just, healthy vagina. If something happens that, for example, you take an antibiotic by mouth. Okay, let's start this over. Okay, now I'm going to talk about women's vaginas. So if that bothers you, feel free to go away or educate yourself and have it not bother you. So, women, let's talk about what a healthy vagina is inside. So, there's yeast and there's healthy bacteria. And usually they're in synergy, like, hey, we're best friends. Yay, let's let's hang out. Everything's great down here. But say, for example, you kill one or the other. If you are taking an antibiotic, for example, you're going to kill the healthy bacteria in the vagina. And women also notice yeast infections from these. How do we avoid causing a death of all the vaginal healthy bacteria during an antibiotic? We really can't. Antibiotics are not like, here, I'm only going to address this one thing, because it's more broad, typically speaking. If you're going to take something for your sinus infection, it's still going to mess up the rest of your microbiome. So for women who are getting yeast infections after getting an antibiotic, because as I mentioned, the yeast and bacteria are in harmony, so you kill this and the yeast are like, yay, I take over everything. It's important for you to take, guess what, a vagina-specific probiotic. That's because the bacteria in our gut, our mouth, our urinary tract, it is not the same, and some of them maybe are the same, but it's not the same composition of each other places. So if you're taking an antibiotic, and great, you're taking a supplement or a probiotic for your gut to make sure that you're not having nausea and diarrhea, you also really need to make sure that you take one that is vaginal specific. I cannot speak to every brand. I don't know which brands are good or not. I will tell you I have a few suggestions, so DM me if you need any suggestions. I'm happy to answer your questions. So if a woman is taking the other things that can destroy the microbiome and lead to issues in the vagina. Number one, if we're having a lot of sugary foods. So if you're having a lot of recurrent yeast infections, one really important thing is to look at your sugar intake. I'm not perfect. I have a really, really bad sweet tooth. So there is no judgment here. However, if you're eating a lot of sugar and you're prone to yeast infections, I would say really try to reduce that. If you know that you have a high blood sugar, you might have prediabetes, diabetes, just make sure you're controlling that blood sugar well and taking a good probiotic. Which leads me to my next point. Healthy bacteria can actually help improve your blood sugar control. There have definitely been studies that show that if you have a healthy bacteria in your gut, your body is less likely to produce a lot of extra sugars through things like cortisol and other things along those lines. There are specific probiotics, one has been shown in clinical trials even, to reduce blood sugar and actually help it stabilize. Now, we talked earlier about weight and healthy bacteria. Well, this is another aspect of the weight and healthy bacteria. So there's healthy bacteria, just to review, there's healthy bacteria in your gut, and the healthy bacteria improves your weight. People that are not, that are overweight may have genetically been born with unhealthy bacteria. Somehow we got some bacteria in there that's not the composition of what we would want. If you're looking for someone with a healthy weight. The other aspect of it is there are also certain bacteria that can help or hurt you when it comes to blood sugar control. There are very specific probiotics that are used to help with blood sugar control. And there was one recently in a clinical trial, I believe, that really showed to help against diabetes. This is the power of the healthy gut bacteria. So reach out to me if you need help with finding the type of probiotic that would be great for diabetes, blood glucose control. And if you have any other questions, I'm happy to help along those lines. Let's talk more about the healthy bacteria, healthy microbiome. What else do I usually see? Okay, let's talk about the healthy microbiome, the healthy bacteria, and strep infection, strep throat. So a lot of people know that you get strep throat, you have little white dots on your tonsils, which may or may not be there, by the way. It's not always there. So what can happen with people is they get recurrent strep infections. So this actually happened to me when I was doing emergency medicine. You know, it's sad. We say doctors make the worst patients, but I kept getting recurrent strep. I'd be in the ER, antibiotics, mask on, I wasn't doing anything contagious, but people will get recurrent strep throat. And the reason for that, you guessed it, is an imbalance of the healthy bacteria. I'm trying to think, perhaps there are other factors, of ways that you're exposing yourself to unhealthy bacteria. But I can tell you that people with recurrent strep infections typically have had the antibiotic has stripped the healthy bacteria out of their mouth and throat. Okay, so when you have strep or any other infection, you use an antibiotic to heal it up and you don't replace the healthy bacteria, you're leaving yourself wide open for recurrent infections. This is even shown in children that if a child has early antibiotics in young years, especially for things like ear infections we see a lot, it sets them up for multiple infections more and more through their life, every type of infection. So can we stop our kids from eating antibiotics? Not always. We can help by using a good probiotic every single day for their whole life, just to make sure we're not setting them up for recurrent infections. Because what happens is when you take an antibiotic, you take all of your healthy immune system away, and you don't have those little initial healthy fighter army, is what I call them, the bacteria fighter army. That is your first line of defense, the immune system. So going back to strep throat, when people have strep, they take an antibiotic. It wipes everything out, all the healthy bacteria, including in your gut and other parts of the body, because the bacteria is not just this one on the tonsil here. It's not how it works. So when you take that, you don't have that immune system, and we're setting ourselves up for recurrent strep infections. We can take the tonsils out. Okay, my first suggestion before taking the tonsils out, again, I'm not opposed to surgery, emergency stuff, antibiotics, any sort of healthcare thing you need, medication. I'm totally fine with that. Just trying to make sure you understand how to decrease the side effects of these medications. So when you take an antibiotic for strep, you have recurrent infections, you need to have that healthy probiotic. For me, when I had recurrent strep, that knocked it out. I stopped having recurrent. Let's remember though, you have to take it during and after the antibiotic, and it may take 3 to 6 months for it to fully work. The good news is that 3 to 6 months is time spent making your body healthier, not just the throat, not just to avoid strep, because your whole body is going to start feeling better with the healthy probiotic. And keep in mind, prebiotics, the way you eat, things like that are also very important to support that healthy microbiome. So let's talk about recurrent infections in general. What happens when we take an antibiotic and wipe out all of the healthy bacteria from our body, or most of the bacteria from our body, which is true in the case of people that may have a severe infection, or taking what we call broad spectrum antibiotic. People don't realize a lot of the antibiotics are super strong. They are not like taking a drink of water. They're going to hurt your whole body's healthy bacteria. So keep that in mind. So one of the reasons people get recurrent infections, and I touched on this earlier about how when kids have ear infections and take antibiotics at a very young age, they get more infections for their whole life. And this is why, if I also suggested that kids should have, if you didn't see that part, kids need to have a good, healthy kids probiotic pretty much their whole life, especially if they've ever been on antibiotics. So in an adult body, what happens when we take these broad spectrum antibiotics that hurt your whole body, that kill all of the healthy bacteria, and just to note, antibiotic use is not without harm. It's not like drinking water. So when you kill all the bacteria with those antibiotics, you're letting the body have no healthy bacteria army. So the healthy bacteria on your body are your little fighter army. The unhealthy bacteria are little invaders. Sometimes it can be the same thing. That's very confusing. Well, if you have any questions about that, I'm happy to explain. So when you take an antibiotic, you kill all the healthy bacteria, you're setting yourself up for infection after infection, unless you take a good quality probiotic and you eat, we call it eating the rainbow. That's a very healthy way to think about to support your gut probiotic. And that means making sure you have a ton of fruits and vegetables, and you want your plate to look like a rainbow of vegetables. It's, green and, orange, red, purple onion or purple cabbage. Just, you can imagine. I'm sure you can get creative with it. So that is one healthy way to support your gut microbiome or your gut healthy bacteria. Okay, we're going to talk about antibiotic resistance because this has been a huge issue of patients. Oh, just give me an antibiotic. I know my body, it's been 2 days. I need this antibiotic. Always makes me feel better. Okay, let's talk about this. So if people are looking for Z-Paks quite a bit, Z-Pak, what is that? That is azithromycin, the medication azithromycin. What happens when you take a Z-Pak, or Azithromax is another name for it? Z-Paks are so common now that a lot of them don't even fight infection. It's called antibiotic resistance. When you take a Z-Pak, bacteria are very smart. Eventually, bacteria start seeing, he's taking this over and over, and those of us that survived the Z-Pak, which will be some, are going to replicate now they've learned from a DNA standpoint. So that's what antibiotic resistance is. Why do people think they feel so much better on azithromycin all the time? Azithromycin is an antibiotic who one of its known side effects is decreasing inflammation. So it's like taking ibuprofen plus an antibiotic. That's why people feel better. In the long run, they're going to have more recurrent infections and they're going to have resistance, and eventually azithromycin will not work. So we have to take that off the table completely of their options for treatment. So if you're taking antibiotics, from another big problem that causes antibiotic resistance is people not completing the full course. There's a lot of research on how long you should be on an antibiotic and why, because the powers that be that study the antibiotics, the IDSA, the International, Infectious Disease Society of America, the IDSA, I believe. So why do we prescribe the course and the dose that we do for each type of illness for the antibiotics? So we prescribe, say for example, with a urinary tract infection, we do, for example, I don't know if your particular doctor does it this way. For me, the guidelines as of this point would be we take macrobid or nitrofurantoin 5 days, twice a day. It's a very common treatment for UTIs, and that medication is great. I feel like it has the least side effects. We even use it in pregnancy as our first go-to. So the macrobid, you go in and you're like, I'm 2.5 days in, I feel fine, I'm gonna stop it. Oh no, my UTI symptoms are back 2 days later. Okay, let's talk about this. What happened? You had a 5-day course, you took 2.5 days, the bacteria that are evolving very quickly, constantly dividing and constantly changing their DNA, have learned now, she took the macrobid for 3 days. I survived. She didn't do the 5 full day course, which would have killed all of us. But I survived, so now I'm replicating, and next time she takes these antibiotics, they will not work. That's the problem with a partial course. One other thing that can be a really big problem is using somebody else's medication and antibiotic. They are not one size fits all. Again, we need to make sure to take care of our gut. If they're an old antibiotic, they may work or only partially work. And if you're taking only part of it or it's not addressing the problem, well, now we have to put you in another antibiotic. So please, 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 I know sometimes it's very tricky to get access to healthcare, and I feel for you. Please DM me or whatever. I can see what I can do to help. But really make sure you're not using somebody else's antibiotic. Really try to consult with a doctor professional that would know the course of length. Ideally, you get a prescription, but again, it is very touch and go for healthcare access. And I feel you on that. I've also been through that. So, when I had a stroke, so I understand it's difficult and very expensive. So, just make sure if you need an antibiotic, get a new one, take the full course, make sure you're taking it for the right problem, and that hopefully you can advise with your doctor or somebody like that. The other big thing, again, to not set yourself up for recurrent infections and to avoid microbial resistance, the bacteria not being treated by by the same antibiotic over and over, again, always goes back to that healthy probiotic, healthy gut microbiome. So please, 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 if you have any questions, you want more material, you think this is awful. Actually, if you think it's awful, please don't comment. I don't care to read that. If you have constructive feedback, please comment. And if you have any suggestions for future videos, let me know. Hopefully everyone got what they needed here. Sorry if it wasn't